Kids Rock Cancer 2.0, an organizational change project by Crystal Weaver. In 2009, Maryville University in St. Louis, Missouri initiated a community outreach program entitled Kids Rock Cancer to provide free therapeutic songwriting music therapy services to children diagnosed with cancer throughout the region. The program was successful for almost a decade, measured by annual donations and the number of children served. Unfortunately, in the summer of 2023, senior leadership decided the program was not viable in its current form. An organizational change project known as Kids Rock Cancer 2.0 provides a thorough organizational change plan to rejuvenate the program. The audience for the presentation is Maryville University senior leadership, including the president, the vice president for finance and facilities, the vice president of community and government relations, and the dean of the College of Health Professions. The SWOT analysis outlines the strengths, weaknesses, opportunities, and threats associated with senior leadership and Kids Rock Cancer. For example, the intended audience appreciates the benefits of music therapy services. The organizational change project also provides leadership the opportunity to collaborate with community partners. However, audience members may have competing priorities. Therefore, the audience must be engaged through the presentation and ongoing communication platforms, such as email, instant messages, and meetings. The change management team includes the director of the academic music therapy program and a newly hired music therapist for Kids Rock Cancer. The team has a combined 40 years of experience providing music therapy sessions in the oncology and hospice settings, including additional degrees and experience in health and business administration. Since its inception, Kids Rock Cancer has partnered with SSM Health, Cardinal Glennon Children's Hospital, St. Louis Children's Hospital, the Cancer Support Community, Mercy Hospital, and the Ronald McDonald House. In addition, the program has served as a teaching modality for the academic music therapy program by offering one undergraduate student per year clinical fieldwork experience. As a 501c3 nonprofit entity, donations and annual grants financially support the program. The organizational change process involves the following components: a change model, Lean Six Sigma tools, an organizational attributes analysis, and an intervention viability analysis, including a sustainability plan. Closton's business platform model was selected for Kids Rock Cancer 2.0. The model focuses on determining why the program is not thriving in its current state and actions to secure the program's survival. Closton's model contains 8 elements: the business idea, the product, the market, the organization, core group expertise, core group motivation, customer relations, and other relations, such as community partners. In addition, various Lean Six Sigma tools were used to assist with the organizational change process. The 5 whys in the fishbone diagram allowed the team to determine the root causes of challenges surrounding Kids Rock Cancer. Kids Rock Cancer has been operating at a consistent deficit for over 3 years. In addition, minimal student involvement does not align with the university's mission and values. Community partnerships are strained as hospital representatives report a lack of consistent communication with Kids Rock Cancer staff. The current therapeutic songwriting protocol is no longer optimal in the evolving healthcare landscape. In addition, in March 2023, the music therapist who had been with Kids Rock Cancer since the inception of the program resigned and formed a competing nonprofit entity in the St. Louis region. Organizational change needs to occur to 1, ensure Kids Rock Cancer's financial viability, 2, adapt the therapeutic songwriting protocol, 3, improve communication with community partners, 4, increase student involvement, and 5, provide separation and distinction from the other nonprofit entity. A qualitative analysis of organizational attributes was conducted by implementing interviews with stakeholders. A specific content analysis process, known as Kalasi's method, a phenomenological inquiry, was used to analyze data gathered from the interviews. Data from the interviews determined the Maryville University faculty and staff associated with Kids Rock Cancer are results-oriented and empowered. The interviews also established Maryville University as a culture dedicated to trust, teamwork, and a desire to continuously improve. The intervention viability analysis has three components. 1, the diagnosed problem. 2, the level of change target. And 3, the depth of intervention required. Interventions for the program will be transformational and incremental. At the macro level, interventions will target changing system-wide elements, such as strategy, leadership, and culture. Regarding strategy, Kids Rock Cancer cannot focus on providing services in partnership with multiple healthcare organizations. Providing services at several sites resulted in untimely response to referrals, infrequent therapeutic songwriting sessions, and sparse communication with hospital and clinic staff, ultimately resulting in a loss of trust with community partners. Kids Rock Cancer must temporarily change strategies to exclusively partner with SSM Health facilities, such as SSM Health Cardinal Glennon Children's Hospital and SSM Health Cancer Care Clinics. Once achieving sustained changes and improvements in partnerships with SSM Health, the change management team will determine when and how to partner with other healthcare organizations in the St. Louis region. The leadership structure of Kids Rock Cancer must also change. Clinical management can no longer be under the Department of Community and Alumni Relations. Instead, clinical management of the program will be the responsibility of the Director of Music Therapy. As a board-certified music therapist and a licensed professional counselor with an additional master's in health administration, the director has the clinical skill set to provide staff, supervision, and oversight, secure formal agreements with hospitals and clinics, and manage patient crisis intervention protocols. Previously, the culture of Kids Rock Cancer was to place the majority of focus and recognition on the former music therapist. Several marketing and public relations pieces focused on the music therapist's personality and musical skills. Unfortunately, values and initiatives associated with Kids Rock Cancer did not heavily emphasize the patients. The misdirected focus has resulted in dwindling donations and grant funding opportunities to sustain the program financially. Moving forward, the culture of Kids Rock Cancer will need to shift. The focus must be on providing quality music therapy services to the children. Marketing and public relations initiatives should emphasize the therapeutic songwriting protocol and the benefits for children diagnosed with cancer. Changes must also occur at the micro level. Human process interventions for Kids Rock Cancer 2.0 will include weekly coaching sessions between the Director of Music Therapy and the newly hired music therapist. The coaching sessions will assist the music therapist with building rapport with stakeholders, refining music therapy skills, and adapting to various job responsibilities, such as balancing sessions with public relations events. The therapeutic songwriting protocol will also change. The protocol was initially limited to patients ages 5 to 18 years. In addition, the protocol followed the same format, regardless of the child's developmental or intellectual level. Moving forward, the therapeutic songwriting protocol will be for patients from birth to 18 years of age. The protocol will also be adaptable to the child's stage of cognitive development, following the Jean Piaget theory. For example, more structured, concrete therapeutic songwriting interventions will benefit patients in the pre-operational and concrete operational stages, while more abstract songwriting interventions are appropriate for patients in the formal operations stage. Patients in the sensory motor stage will participate in a heartbeat song intervention, which involves the music therapist recording the infant or toddler's heartbeat with specialized equipment and building an original song around the heartbeat's rhythm. In addition, the music therapist will experience a new division of labor by assuming the additional title of music therapist in residence at Maryville University. The music therapist in residence will act as a mentor, guide, and expert for all music therapy students by providing guest lectures and master classes, thus teaching, preparing, and inspiring the next generation of music therapists to assist children diagnosed with cancer throughout the St. Louis region. Human resource interventions will focus on retaining competent staff through goal setting and career development. For example, the music therapist will create a V2 Mom at the beginning of each academic year. V2 Mom, which stands for Vision, Values, Methods, Obstacles, and Measures, is a strategic planning and goal setting framework. The development and execution of the V2 Mom will allow the music therapist to structure annual career goals in coordination with Maryville University's strategic plan. Kids Rock Cancer 2.0 will focus on trans-organizational development by creating and maintaining beneficial partnerships with SSM Health. For example, the music therapist will frequently huddle with the SSM Health staff. A huddle is a short stand-up meeting, 10 minutes or less, that is typically used once at the start of each workday in a clinical setting. Regular huddles will allow the music therapist to address patient challenges and refine protocols with the hospital and clinic staff, thus ensuring frequent communication and the coordination of efforts to provide beneficial services. The level of change is determined by the individual, group, intergroup, organization, or trans organization. All macro and micro level changes will involve one of these entities. A table has been developed pairing each change for Kids Rock Cancer with the corresponding level of change. Interventions associated with Kids Rock Cancer 2.0 will focus on operations research and management counseling. The director and the music therapist will establish objectives for performance and monitor performance against the objectives. For example, the team is hoping to begin the implementation phase of the project by September 1st. In addition, the director of music therapy may seek assistance from a consultant. The director can increase awareness regarding personality and role relationships by working with a consultant. In addition, the director may further appreciate how previous experiences with former Kids Rock Cancer staff have influenced personal management style. Following the implementation of interventions, a balanced scorecard will be used to evaluate the ongoing productivity of Kids Rock Cancer 2.0. The scorecard approach allows Maryville University senior leadership to review performance from 4 perspectives against short and long-term objectives, including 1, financial perspective, 2, customer perspective, 3, internal process perspective, and 4, learning and growth perspective. Kids Rock Cancer is a therapeutically beneficial program with over 10 years of service in the St. Louis region. By engaging in active organizational change at both the macro and micro levels, the program can once again flourish and support children during pivotal moments in the cancer treatment and healing process. Thank you.